Good morning, Simone.
Good morning, doctor.
So, first pregnancy.
Yes.
You sure you're ready for this?
Mm-hmm.
Okay. Pregnancy can be a little challenging, especially with someone in a high-stress career.
Sure.
Have you considered how this might impact your ability to handle everything?
Yes, I've been preparing for this. I work remotely and my employer is pretty supportive. But I'm just trying to make sure that I'm doing everything I can for my baby right now. But I've been feeling a little tired lately.
Okay, well, that's good that your employer is supportive. But you should know that statistically, complications can arise more often in certain populations. It's just something we want to keep an eye on.
Okay.
How's your exercise and nutrition been?
It's pretty consistent. I cook most of my meals at home and I stay active.
Okay, well, that's good to hear. Well, we'll just do some basic labs and vitals today, and then we'll go from there.
Thank you, doctor.
You're very welcome.
Thank you.
Simone, good to see you again. How have things been going?
I've been a lot more tired lately and a little bit winded while walking, even while doing small tasks.
Well, you're in your third trimester, so that's to be expected. A lot of women feel winded from the baby pressing against the lungs. It's nothing unusual.
I guess it's just a little bit more than I expected.
Okay, we'll try to get some rest. We'll keep monitoring, and we'll do another routine panel at 36 weeks.
Okay, doctor. Thank
Okay,
you.
you're welcome.
Dr. Reynolds, I'm having trouble getting accurate oxygen readings and fetal tracings on Simone Carter. She wants to be up and about, but she just gets so short of breath sometimes.
Okay, well, she's in active labor, so her breathing can become erratic, okay? Let's not overreact.
Hey, Mrs. Carter, can I check your vital signs?
I have birthed 3 babies, actually, and none of them were that great. The experiences were all very traumatizing for me. My first baby, he passed away. So I've had 3 kids, but my first is no longer here because he had a heart condition. And they had to do surgery when he was a week old. I feel like he could have lived. But, I can't prove anything, obviously. But I've seen many babies walk out of the hospital where I once worked at. I mean, I used to work in the ICU, and my colleagues actually took care of my baby. When I was pregnant with him, they had told me he had all these heart problems. And then the doctor told me that it was my fault that he had these problems. And I was like, what do you mean? Well, your sugar is probably the reason. And I hadn't been diagnosed with any diabetes or anything. So I got a lot of in my ear still, feeling like something I did might have caused the issue with my kid. And then after having him, and him having so many complications after having surgery, and I don't know. I just felt like you know what I did? I put a picture up of him on his warmer, because I wanted you all to know that he's a baby. He's mine. He's not just a patient. And it may just be me and my feelings about what could have been different. But I've also seen it be different. Personally, I am not the type to be screaming and hollering because of pain. Does not mean that I'm not in pain. And so even though the monitor showed that my uterus was contracting longer than it should, no one came in to assist me because I wasn't saying that I was in pain. Just based on what I know, that there was probably a lot of different assumptions, because again, I'm not gonna be screaming from my lungs that there's something wrong, like help me. Like I'm gonna patiently wait until somebody come in. Like for an example, when I was birthing my last child, I had to actually be induced because she was 9 pounds and I was 38 weeks. And she would have been 10 pounds if I had waited. And so this was at the height of, not quite the height of COVID, a little bit past the height of COVID. And so it was, okay, we'll call you when we think you are, we're ready for you type of thing. So that capacity was good and only my husband could be there type of thing. And so they put me on Pitocin, which is what they use, the medication they use synthetically that we naturally usually make, but they synthetically, produce to make sure you start your labor. And they turned me up and I started laboring. The nurse and I was doing it natural, no epidural or anything. And Pitocin it does its job and it does not feel good. And the nurse, I was upright laboring, holding on to a hand grip, trying to, let everything do what it's supposed to do. And the nurse walked out. Now, at this point, my contractions were on top of each other. Normally, you should have a contraction. It should relax. You should have a contraction. There were no relief. And I was like, where is this nurse? But my husband's sitting there because I'm still very composed about it. I'm like breathing. I'm making noises, but I'm not screaming at the top of my lungs. When she came back, I said, where were you? She was like, oh, your body done took over. Like, poor thing. No. The monitoring system is out there. You can see my contractions doing what they're doing. And they're stir-stepping. Like, where were you? Like, I had tears. Where were you? Because that's what your job is to make sure. So she came in and she turned it down. And, I went about, but I thought my insides was being pulled out. That's how much it hurt. And my husband had no idea. It wasn't until recently. He's like, I had no idea, honey, that you were doing that because you made it look easy. I mean, physiologically, when we are in pain, certain things happen. Our heart rate goes up. Our blood pressure goes up. There's a lot of things you can look at other than somebody's words in their face to know that they're in pain or there is a problem. I ended up having postpartum anxiety as well. I literally was like, somebody needs to be with me at all times because I don't know what's going to happen to me. I don't know what's going to happen to my baby. And I felt jittery all day, every day for months. And I ended up needing to be placed on medication because of it. And I think it's between having the baby and being dismissed and all the different, all the things that kind of came together at that time that my body was like fight or flight. It's taken a while to get where I am now after having her. It's not an overnight healing process. Even I tell people all the time, there's 3 types of human beings. There's women, men, and the birthing person. I'm sorry, because you become somebody else when you are pregnant and after you birth a baby. You become another person. And there's a lot of things that come along with that. that I think a lot of people don't realize, especially if they never experience it. And then again, when I've said before, like every experience is also different. Every pregnancy is often different. And so, yeah, it took me a while to get back to me, both physically and emotionally because of all the things that has happened. I think one of the biggest challenges people have is navigating our healthcare system. And being that person to do it alone is really difficult at times. I don't think that it's designed in a way that allows people to get what they need when they need it. In the United States, we're not very good at birthing babies. Our statistics are horrible compared to other developed countries. We're like literally at the very bottom. I wholeheartedly believe I would have died if I did not advocate for myself. I think the steps that can be used to reduce bias in maternal health, and particularly experienced by Black women, is, well, our cultural humility. So really understanding the space in which people come from, not just being competent in the cultural aspects of somebody's life, because even in cultures, people are different. Everyone is not the same. And so it's going to be really important that you get to know a patient and what their experiences are and what they need from you to get through their journey. There's large studies out there that says that Black women feel neglected and not valued when they are navigating the healthcare system. And so being able to show that they are valued is one of the biggest steps. I don't have, big ideas that there's this one tool that's going to fix everything. But I'm certain those two things would be a big chunk of it. When people are doing their job, they might not necessarily listen as closely or as actively as they need to. When you are interacting with a person, you're more likely to do that though, right? So if you think about, okay, I'm hitting all these tasks, the tasks are going to be completed. But if you stop to talk to the patient and listen to the patient, then you might get a different outcome, right? One that is probably better for the patient because you took the time to understand what was needed. And for me, definitely was making sure me and my baby stayed together, and that I was treated with the proper treatment plan